In this season's Money versus Medicine series, we're covering how the healthcare system can affect your family's health as well as your family's wallets. The Trump administration recently announced plans for price transparency, but there's already pushback from several hospital and insurance groups, so time will tell what happens here. But the hospital price transparency rule essentially would require the disclosure of negotiated rates. It would ideally be implemented in January 2021 if it withstands a lot of the challenges that are out there. A second regulation, which is just a proposed rule for now, would require insurers to tell patients their out-of-pocket obligations ahead of time and also to disclose negotiated rates with providers. And I have to say, I always think more transparency is better. But I also think this second concept of letting people know beforehand the expected out-of-pocket cost is huge. Because listed prices, it is important to show those, but we all know that they're all over the map.
Right.
So we need transparency when it comes to listed prices, but we also need transparency in terms of, okay, if you're going to come in and have this procedure done, this is your expected out-of-pocket expense. Because for you, the individual, that's what you care about, right? You care about, well, how much is this going to cost me? I'm struggling with why we're having so much trouble with implementing transparency.
This. Well, I mean, I guess we were heard because we've said it on this show. We've been up there begging for these changes, and somebody heard us. I just hope that it's going to happen.
I'm dubious.
Yeah, I feel like people are really fighting this. You know, there's already been people who are complaining about it and saying that this is going to be confusing for people, that all of this information, people won't know what to do with it. And they're also saying if we start to list all of these prices, then actually it's going to drive the price up because people who are actually offering things at more of a lower discount, they're going to see that, whoa, my competition's charging more, I'm going to charge more. Now, I don't know if any of that makes sense, but it certainly might scare certain people. And I actually believe it's wonderful that you can have, for example, in the second part of the rule, that you will see the 300 most common medical procedures with all of your out-of-pocket expenses beforehand, instead of getting that explanation of benefits document weeks after, and all of a sudden you're realizing that that was thousands of dollars.
Until I see this actually happen, I'm going to continue to be dubious. And I worry that at times the healthcare system is also just used as a political ploy. Various parties saying, well, hey, we want this, we want that. And then it becomes this big political thing. And you know who's forgotten? The patients.
That's right.
And I think that more transparency about the conversations, pricing, all of this would be a good thing. But let's just see what happens.
At least we're discussing it. It's going to be a big uphill battle. It's a challenge. And, you know, talking, it wouldn't be the earliest January of 21. We don't know who's going to even be in office. And
we do not. One thing you can do now, though, is there's nothing that is against the rules for you to get your insurance policy out, look at it, and let's say there's something elective that you have coming up. It's okay to inquire, call the billing office ahead of time, inquire about what might this cost me, what is the out-of-pocket expense, if I use my insurance here, what's the cost going to be? Because the more that you ask questions ahead of time, the more likely you're to get at least some type of transparent answer. The problem that we have right now, and look, I've done this, probably everyone in this room has. It's where we go get something done, we just kind of assume. We assume it's covered by insurance, and that's when the bills start coming in and you're scratching your head. And it's better late than never to go talk about a bill, but sometimes the best way to do it is up front. Try to get transparency for yourself, even if our healthcare system seems to lack it altogether.